assessment, I will be showing you how to collect a fingerstick capillary blood sample. So for this assessment, you're going to have your client stand up and you're going to have them have their hand out, palm surface facing up. And so for prick, it's best to do either the ring finger or the middle finger because those are the fingers that can develop more blood at a quicker rate for the blood sampling. So what you do is for this, you can also have the client, you can put their arm underneath them. And what you do is you get alcohol and you wipe their hand off and make sure you have gloves. I'm at home, so I don't have gloves, but make sure you have gloves because it's with blood. So you're going to take their middle finger, you're going to wipe it off with the alcohol. Usually you have an alcohol pad, but I pour alcohol on this paper towel. You're going to wipe their hand off with the alcohol pad. Make sure that the alcohol dries up first before you take the finger stick prick. It's very important so the blood and alcohol won't mix together. So after you do that, I always have the client come underneath me. So because some people are afraid of blood or seeing blood, or they get anxious when they're about to get pricked. So I have them hold their hand out. And what you're going to do is you're going to make sure you prick on the distal end of the middle finger so it can prevent bone injury, bone tissue injury. And it will give you a sufficient amount of blood. I don't have a finger prick, so I'm going to modify it. So this is the lancet where the finger prick will be. What you'll do is you'll press down hard for a few seconds, and then you bring it back up and you'll squeeze it and take the blood from there to put into the lancet so you can collect it. So like I said before, make sure that you are pricking the distal end of the finger, which is basically this end, closer towards the end of your finger on the distal side. And you're going to prick it, press down hard. You're going to collect the blood samples. Always remember to let the alcohol dry up first, and then you take the blood samples from there. So remember, always use the middle finger or the ring finger, and it is best sometimes. And you also let your client know, hey, I'm going to be in front of you, grabbing your arm so they can feel comfortable, so they won't know. So they won't feel like, uncomfortable or feel like you're just in front of them. And always tell them, like, on the count of 3, 1, 2, 3, I'm going to prick your blood, and then it's going to be quick and simple. Always remember, distal end of the finger, middle finger, or ring finger. Always let the alcohol dry before you take the sampling. Thank you. And also, lastly, before we leave, the reason why we do finger stick capillary measurements is to measure if a person is anemic, check blood sugar levels, and also we can check thyroid function as well for a client. And we can also get blood lactate levels out of this as well for the athletes or a general population individual that comes in a lab or come in a hospital and want to know their blood sugar levels or their red blood cell count or just, anything in that area. So thank you.